We're excited to announce that our podcast, The Table with Renee Da Silva, is evolving. We're introducing 3 new streams of content on this podcast, designed for health system CXOs and hosted by the Health Management Academy's subject matter experts for health system nurse executives, health equity officers, and strategy executives. With this change, we'll be activating health system leaders towards outcomes and scalable solutions you can implement now. Welcome to the Health System CXO Podcast, featuring 3 streams of content designed for health system nurse executives, health equity officers, and strategy executives. I'm Jasmaine McClain, Executive Director at the Health Management Academy and Health Equity Officers host, and together we'll explore equity in plain language and assist you as you navigate the complex structural challenges associated with system transformation and health disparities. Welcome back to our equity channel. Let's talk about something our team hears constantly from health equity leaders. We have leadership buy-in, but we're still struggling to drive real change. Today's burning question: how do we move beyond surface level support to create true champions who will move health equity forward, even when budgets are tight and attention spans are stretched? It's interesting, we spend so much time celebrating when we get executive buy-in, but the hard truth is that buy-in alone isn't enough. Through our research with the Health Equity Alliance, we found that success hinges on 3 key factors. 1, clear internal alignment on the health system's role in advancing health equity. 2, translation of system priorities into individual executive priorities across functions. And 3, demonstrated value of health equity investments that resonate with different stakeholders. Today, I'm excited to share some concrete examples of health systems that are nailing this work. We'll talk across 4 key internal influencers: mission, culture, strategy, and governance. Let me start with a mindset shift that's crucial. Health system CXOs have to stop thinking about health equity as a standalone initiative and start seeing it as a lens for every aspect of health system operations. We've spent time assessing the stated missions among not-for-profit health systems as one way of understanding the enterprise's stated motivations. There are 3 types of health system missions that we typically see. First, those that are focused on delivering healthcare as the core mission. For example, Inova, based in Falls Church, Virginia, describes its mission to provide world-class healthcare every time, every touch, to each person in every community we have the privilege to serve. 2, we see missions that are centered on health improvement and well-being. For example, Intermountain Health describes its mission as helping people live the healthiest lives possible. And third, missions that link faith and health. For example, Advent Health, headquartered in Altamonte Springs, Florida, articulates its mission as extending the healing ministry of Christ. Now, this has implications for how committed organizations then translate the focus of their health equity work into tangible, strategically aligned goals. I'll give one example. At Intermountain Health, CEO Rob Allen frames health equity as directly enabling their mission of helping people live the healthiest lives possible. Here's what he said, and I love this quote: "Our mission demands that we look at going upstream to divert or direct resources from traditional models into the community at large." Now, the most successful systems don't just talk about mission in the abstract. They also work deliberately to build a culture of equity system-wide. They create what we call culture paths at 3 levels. First, CEO-led culture setting, recognizing that the CEO acts as an irreplaceable compass for the organization and sets the tone on health equity as a strategic priority. Second, executive-led culture setting, recognizing that senior executives lead the charge on consistent communications and execution across the organization. And third, workforce-led culture setting, where the individual expectations around the system's commitment to health equity are made clear. For our third influencer, let's talk about something that frankly can sound a little dry, but is absolutely critical, and that's governance. Without clear governance, health equity becomes everyone's responsibility and no one's priority. There are 3 levels of governance that need to be working in harmony: board governance, cross-functional system governance, and local governance. One of our favorite examples is from WellSpan Health, headquartered in York, Pennsylvania. Their vice president of community health, Ann Kunkel, told us their secret sauce is striking the perfect balance between having a point leader and ensuring matrix responsibilities. Ultimately, the chief quality officer is accountable for the system's work surrounding health equity, but health equity is truly embedded into multiple executive scopes of responsibilities. One vital sign that we tend to see of effective governance: regular board-level discussions with equitable time allocation. This is not just another agenda item that you squeeze in at the end of a meeting. And finally, and this is often where rubber meets the road, strategy. A recent survey at the Health Management Academy of 30 health systems revealed some fascinating trends about strategic growth. 90% of strategy leaders that were surveyed report that improving consumer experience is a part of their growth strategy. 87% are working to attract patient volumes. An understanding of this creates perfect opportunities for health equity leaders. For example, when Providence launched a health equity fellowship program in 2023, they didn't just talk about disparities. They talked about staff retention, workforce engagement, and consumer experience. They spoke the language of their executives. Now, here's a practical tip. When you approach your strategy leaders, frame health equity in terms of untapped patient volumes, market opportunities in underserved communities, improvements in consumer experience, and workforce retention and engagement. So let's wrap up with a few recommended steps as an action plan. First, map your champions. Identify where each C-suite leader sits on their own health equity journey. Second, speak their language. Translate health equity value into terms that matter for each executive. Third, use data strategically. Don't only focus on highlighting specific disparities. Show the concrete impact on strategic priorities. Fourth, build a strong governance muscle. Create clear accountability without creating silos. And 5, link to growth. Connect your health equity work directly to your system's strategic growth paths. Before we close out this episode, I'll leave you with this thought. Building champions isn't about convincing people to care about equity. Frankly, I'm not sure you can. It's about showing them how equity enables what they already care about. As we gear up for 2025, we're excited to dig into all of the intricacies of external alignment, how progressive organizations are building partnerships beyond the metaphorical four walls of the health system that are critical to sustainable change. We're continuing to study these trends across leading health systems, and we'd love to hear your experiences. What's working for you all? What's not working for you all? Reach out to us at healthequityalliance@hmacademy.com. We'll see you next time. Thank you for joining me on the Health System CXO Podcast, where we activate health system leaders towards outcomes and scalable solutions you can implement now. Remember to subscribe to the Health System CXO Podcast on your favorite podcast platform so you never miss an opportunity for insights. If you like this episode, consider leaving us a review and sharing our podcast with your friends and colleagues. You can also connect with us on LinkedIn by clicking the link in the episode description. See you next time.